our second presenter, and that's Professor Alex Brown. And Alex is the theme lead in Aboriginal health equality at SAMRI in Adelaide there. And he's also a Professor of Medicine in Aboriginal health at the University of Adelaide. Alex is both a medical doctor and a researcher. He got his PhD in 2010, and his research is nationally recognised and internationally recognised as in both urban, rural and remote communities. But through his medical training, he's done a Masters of Public Health. He's also he's a Fellow of the Cardiac Society of Australia and New Zealand, an Honorary Fellow of the Royal Australian College of RACGP. No, not CGP, RACP. Physicians, yeah. So he's looked at chronic diseases in vulnerable communities with a focus on epidemiology, psychosocial determinants, looking at mixed methods of health service research, randomised controlled trials. It's covered a whole lot, and that pharmacological and non-pharmacological trials in chronic disease intervention. So, Alex, we could go on, but let's hand over to you, my brother.
Thanks very much, Tom, for that very long-winded and slightly embarrassing introduction. It's a great pleasure to be here. I'm calling in from Ghana country, where I've been for the last 8 years, but certainly very keen to acknowledge traditional countries all around the nation where people are calling in from. Really grateful for Tiff for her overview. That means that I can be the dolt that I am and not have any real knowledge of genetics whatsoever, and just talk in hyperbole, as many of my team who are online will know I want to do. So I thought I'd just give a slightly different perspective around where Aboriginal and Torres Strait Islander people may be in this journey, and what are some of the challenges and opportunities moving forward in the precision medicine space, as well as genomics more generally. So let's hope I can do a reasonable job of that. Firstly, my disclosures. I'm not a geneticist, and I sometimes struggle to spell DNA. I'm also not an anthropologist, which seems to also be a necessary entry qualification in this field at the moment. Probably the more important issue to raise is that we haven't got this all sorted yet. This is a beginning period. We're in a developmental phase of growing capability and capacity, fundamentally, which should be led by Indigenous peoples and Indigenous interests. But we're not there yet. And hopefully over the next 5 to 10 years, these early beginnings will start to blossom, and we can identify the next generation of Indigenous people leading the charge in this specific work. This slide also sort of lets people know where I'm from, Yuin Nation, all down the south coast, and you can see here some images, some wonderful, some concerning about my country. You can see a whole bunch of Canberra bureaucrats' houses under risk there in the south coast early this year, but they were all safe and well. So that was just being overly cheeky. So where did we begin in this journey? Well, we've sort of came into this field kicking and screaming in many ways, largely because Indigenous peoples have always held very high levels of suspicion about the genomics agenda. And in many ways, people have suggested as a consequence, Indigenous peoples have been left behind. But my view is that we can only proceed at the speed of trust. This is a term that people like Greg and others have used really well, and I think it encapsulates where we're at in this journey. As Tom mentioned, we've done a lot of work in chronic conditions. This is the diabetes league table across many nations and many Indigenous populations across the globe. And Australia has a very, very particularly poor record when it comes to really responding to the needs of Indigenous peoples with diabetes. Now, Indigenous populations across the globe very high rates of diabetes, but where Australia is miles ahead is in the mortality burden, which suggests that we're not doing our job in a whole bunch of areas, particularly in healthcare access and therapeutics. Now, we have explored what really drives the diabetes story in Aboriginal and Torres Strait Islander people, and there is this very, very particularly important phenomena that we term as intergenerational risk of type 2 diabetes. The first data in this was really encapsulated beautifully in Pima Indian populations in the US. This is the left-hand part of this slide. And what they were able to identify is that children born to mothers with type 2 diabetes during pregnancy, up to 70% of those offspring had type 2 diabetes by their early 30s. Now, this is not a product of too much Coca-Cola, not exercising enough, being too silly to listen to your doctor, which is often the medical frame for diabetes. This is clearly an issue at play around the transgenerational transmission of risk. And we think that there's a story to understand here so we can better respond to the diabetes epidemic in our communities. Now, before we begin with anything, we always start with community. And so we wanted to know from community perspectives how they view diabetes and what was going on. The medical view, as I sort of touched on, was really about people get diabetes because they're poorly behaved, they make bad choices, they're too lazy, they're too fat, and increasingly now perhaps they've got bad genes as well. The Indigenous view is very, very different. They talk very strongly about dispossession and disharmony, the impact of profound disadvantage, of socio-cultural change, of not having access to land and culture, the things most important to our health and well-being, and the story of transgenerational trauma. Now, genomics offers us windows into understanding empirically whether or not these stories are at play, and my view very strongly is that Indigenous people's understanding of diabetes and its complex causative chain is a much stronger and more accurate position to understand complex diseases like type 2 diabetes. Now, we get ourselves into this terrible muddle when it comes to this rise of precision medicine, and much of it, particularly as a population health or public health researcher, is this challenging notion between what precision medicine does and offers and our previous requirements of focusing on the needs of the many, or a population health approach. And they are distinct. The question is, can we tie the two together in some way and have a precision prevention agenda? Precision focuses on the micro, very small. Population health is on the population, the collective, the macro features of a person and their lives and their construction of illness and also wellness. The precision medicine agenda has largely been profoundly Eurocentric, as Tiff mentioned, but population health has a requirement for us to push beyond that and think about global diversity. The precision medicine largely is focused on the gene. We think population health needs to drag the genes kicking and screaming into a better understanding of context and environment. We think it has much to offer in terms of prevention. Our focus is on the rights of the individual and collectives within a population health frame. The precision medicine agenda is sort of focusing on, well, how do we make sure everyone can get access to it and that their data is available freely for everyone to share? And there's tensions there in an Indigenous health space. And fundamentally, whilst precision medicine will likely identify new pills or new therapies, population health still understands the importance of dealing with the root causes of inequality, such as disadvantage and poverty. The question is, how will we reconcile these two competing ways of understanding into the future? The way we've approached it is to work with Aboriginal communities right across South Australia to undertake a very comprehensive understanding of diabetes, both from a biological perspective, but just as importantly from an environmental and a contextual story as well. This is our sort of conceptual framework for the study. We are interested in genetic variation and how genes are expressed. We want to see how that relates to a range of individual characteristics, not just the things people do, but how people feel and how their body responds to the environment in which they operate, and then how this relates to the development of diabetes and diabetes complications. And importantly, how this all fits within the environment in which people live, both the immediate, but also the historical. And so we think that the genomics era does offer us ways of understanding this very broad set of determinants of complex diseases like diabetes. The critical part here is being very, very clear and explicitly clear with communities about how we use people's data. And you can see here part of our consultation guideline that we work with community organisations and communities as well as individuals about how we're going to use their information and what's it for. Why are we collecting information on whether or not your serum rhubarb level is elevated? This is a very important part of the genomics engagement story, being very clear about each of the data uses, being clear about what data we're collecting and why, and then what's going to happen to it in the future, including whether or not other people are going to try to have access to it and whether or not people have a sense of comfort with all of these sorts of approaches. So I know it's a busy slide, but I wanted to sort of frame that having proper conversations around genomics and genomics research in particular, which we come at this from, not from a clinical perspective, consultation and discussion with both individuals and community organisations is critical. What we've also come to understand, probably took us a bit long, and people will say, well, where were you? Why in God's name did it take you so long? With all of these conversations about how carefully we thought we had to deal with DNA for genomics research, we realised that every piece of data given to us by a participant in our research, whether it's a story, whether it's their blood, whether it's a questionnaire, should be treated as the gift that is given to us. And we should be as careful with that data as we are with people's genomic sequence data. And importantly, we want to give thanks to that gift and care for it very, very wisely. This involves a whole range of consultation, as you'd imagine. Importantly, focusing our research on priorities from community, having Aboriginal and Torres Strait Islander people in control of the process and what happens with their data, adhering where appropriate to the right cultural protocols around blood collection, about blood use, about blood storage, and the treatment of the other data that people give us, being fundamentally accountable to that, being clear about what the benefit is rather than what the benefit may be in the future. And I think researchers are really good at overselling benefit when it comes to consultation with Aboriginal communities. We also accept that we have guardianship responsibilities and obligations, as well as our role as custodians of the gifts given to us. And we appreciate and understand this particularly being driven by Māori scholars and geneticists, is making sure that the benefit of the gifts given can be shared in the future to make a difference to other people's lives. Clearly, there's work for us to do in that space in Australia, but we're on that path. The concerning element of, from my perspective, in the genomics era is the use of coercion to engage Aboriginal people in this type of research. And I don't mean in the clinical space, I do mean in the research context. And we're given two sort of fundamental pictures. One is selling the dream. So we're sold that there's a promise of the new genomics era in medicine, that it will solve all rare genetic disorders. I think that the dream of preconception screening is of concern, even though it may have benefits into the future. We're not there yet. We're told that genomics can solve the ills of Aboriginal lives, and there's been many narratives around reconnecting the stolen generations, which I think is problematic on a whole bunch of fronts. But we've also been told that if we don't engage in genomics, then you're going to miss out. And this is this fear and loathing mentality to widening disparities that we'll be held accountable to because we choose not to engage in a genomics future. And I think these two elements of the pitch for genomics far outweigh the benefits that have been delivered thus far, but are important conversations for us to have as communities and as researchers and as clinicians to make sure that we have very high levels of community literacy about what genomics is, what genomics can offer, and what genomics will likely to deliver into the future. So I think that even though it sounds like I'm poo-pooing all of this, we're actually very engaged in all of these conversations to find better ways to work through how do we have communities own this process and be involved in their own destinies. We think we're always talking in Aboriginal and Torres Strait Islander health about what's wrong and what's bad. We tend not to think about what we offer the world anywhere near as much as we should. And I think that we're trying to re-establish a space for us to have conversations and lead as Indigenous thinkers in this space. You can see on the left this sort of, very scrappy hand scribble of mine, looking at how the world has become focused on the omics of everything, and we're splitting everything into its smallest component parts. Now, fundamentally, I don't have a concern with that. As trained as a scientist, reductionism has its role. But the question is, who's going to pull it all together? The question is, how do we explore and deliver precision medicine in an Aboriginal and Torres Strait Islander health context, in a cultural context, the right way for the future? How do we protect people from the inequality that may come from inequitable distribution of not just access, but also the deliverables or benefit that comes from these emerging technologies? How can we recapitulate the whole? And through this, can we reconcile this genomics and public health story? And I think we can. And so we need to ask, what do Indigenous people offer the world? And I think in the context of genomics, we offer very important gifts about how we should conduct this work. How do we steward or become custodians of these very important pieces of data? What's the ethics? How do we integrate? How do we communicate it? How do we interpret genomics and make sure the benefits delivered to communities? And I think we've got real strengths in understanding, communicating, and reimagining what context really means outside of the reductionist genomics story. How does that relate to the social construct, the story of place, the story of people, our history, our culture, and what does this offer in terms of the way we understand disease, particularly complex diseases like diabetes? And that's the path that we're keen to treat. We think the current characterisation of the exposome, see, we've entered the world of omics, so you just make up a word or have a word and put ome on the end of it, or omics. We could call this the contextualome, the exposome, or my preference is the indigenome, but anyway, that's another story. As it currently stands within most of the genomics research, looking at environmental impacts, it has been quite simplistic, poorly standardised and incomplete. And I think it misses some of the root causes that drive inequality that we see in our communities. And I'd much rather we start with something like on the right of this slide, which is an Aboriginal construction of context, well-being, culture, family, land, and the importance of being connected and caring for one another, which is a much more holistic approach to understanding context, and in which I think genomics medicine needs to embed itself more completely. So where are we at in terms of Australia and undertaking genomics research in Aboriginal and Torres Strait Islander health? We clearly don't have a reference genome yet. I think there's significant work on that. Whether or not one will be enough is probably a question for other experts online like Simon. We're still not to the point of data sharing. I think that will change. We're not quite ready because the level of trust isn't there yet. We're not talking about open access yet. I mean, we're talking about it, but there are concerns still about on whose terms data should be openly shared. There is efforts around biobanking, but most of the conversations about holding places rather than withdrawal spaces where people can access Aboriginal people's DNA. And I think that's appropriate for where we are. I don't think we've got high levels of community literacy around genomics. There is efforts around clinical services, and they are making headway in Aboriginal and Torres Strait Islander families, but the numbers are very small, and we haven't invested in the capability development, the pipelines and bioinformatics or genetics experience in Aboriginal and Torres Strait Islander people yet. So we've got a way to go yet. So if we were to think about the precision agenda in Aboriginal health, what are the possible benefits? Because I don't want to leave this conversation with everyone thinking that I think that there's no role here for genomics in Aboriginal health. There's clearly an opportunity to construct wellness more holistically from an Aboriginal lens, which may help the genomics era move forward in a more complete sense. It should be able to assist us if done well, but it will take time to predict, delay and prevent disease, which is our fundamental objective. Aboriginal and Torres Strait Islander people understand the importance of consumer or community voice in these efforts, and I think are important leaders in this area. It probably will get us back to the importance of healthy diet and food as medicine, which my great friend Donald Warren from South Dakota talks about constantly. It may help us understand intergenerational risk. And for some people, the very important story of documenting the impact of colonisation and intergenerational trauma may come from our understanding from a scientific perspective, what we can get from genomics understandings. But there's heaps of risks. We're still too Eurocentric. We need to focus on collective rights and interests. We need stronger provisions around data sovereignty, trust and privacy. We need to work on genetic literacy. We need to understand thus far hype far outstrips the reality in the delivery of the genomics era to Aboriginal and Torres Strait Islander health. And the benefits aren't there yet, but there is potential. And I think we need very strong approaches to intellectual property, Indigenous intellectual property protections. And we must ask the really hard question, which is, this is expensive business. We're still struggling to make sure that every kid gets a good breakfast in this country. What's the appropriate diversion of scarce resources? And these issues of utility and fairness are an important part of the story. So I might leave it there, Tom.
Yeah, thank you, Alex, and very sobering. And I think it's critically important. The issues that you raise are ones that we address, and that's why we see genomics as a wicked problem that needs to be really considered and work it out, because and look at the influence, because there are both the benefits, but there's also a whole range of challenges that we have. And you mentioned data sovereignty, and some of this will be picked up in Simon and Greg's presentations as well, in the sort of practical application as we're seeing it online. In relation to data sovereignty, we did have one of the questions out there, and that is, how we can protect our data if the agenda shifts away from an essentially an altruistic agenda as we currently have it. And I guess that's one of the big challenges. And there was a mention, I think Tiff mentioned, that there is one of the groups is out there looking at data sovereignty in relation to to genomics, and it goes beyond genomics. Actually, it's when you look at the cancer registers that exist around the nation, they all become part of a global accessible database, and so who uses that and who can benefit from that data. So I don't know if you had a comment on that.
Yeah, probably a couple, Tom. I mean, the road to hell's paved with good intention, right? So altruism alone is not going to get us to a safe and equitable future. Had that been the case, we wouldn't have the inequalities we see in Aboriginal health. So there is a very strong data sovereignty movement. And I think from an Indigenous perspective, this is a really important part of not just the genomics story, but also a research and community story as well. And it's been led by Indigenous scholars from around the globe who are probably giving this much more thought than I would say virtually anyone else, except a couple of, sort of really expensive law firms tucked away in Manhattan. So this is a really important story, and their expertise in this area is unparalleled. And I take advice from them about how we need to provide appropriate protections and management of data. The sharing story is the hardest one, largely because we're not to a point of trust yet, although I think that will come. The way in which we've set up our work is I've got about 5 or 6 fail-safe mechanisms so that data can't just get out there, and I can't even be pressured to share data. It's got to go through a community and cultural governance process beforehand. We've set up our ethics very clearly around what we're allowed to do, both in terms of the ethics applications to ethics committees, but also individual consent. So we've drilled right down into very clear and explicit ways of what we can and can't use the data for. And that people have complained to me about that. They say, well, Alex, we can't get our hands on your data. And it's not quite the case, but we have made it difficult purposefully, because I think we need to learn how to crawl before we walk. And we do need to demonstrate to communities that we can be trusted as advocates for them, but also scientists and researchers in our own right. The data sovereignty movement will provide very clear guidelines, particularly focused around the FAIR principles and the CARE principles, which are an additional sort of cultural context laid or lens over the top of data sovereignty principles. We need to be very mindful of those because I think they're very, very erudite, and we should be guided by them and our relationship with communities around their data.
Yeah, thank you, Alex. And whilst we're talking specifically on data around genomics, I recall that Professor Marcia Langton at University of Melbourne's recently received a significant grant to look at Indigenous data sovereignty, and is pulling together a group of people. So it's how do we, I guess the challenge is how do we get the various parties, and there are quite a number in Australia, even amongst Indigenous people, working on data sovereignty and IP and so forth. And the IP is another question that Simon might pick up on his presentation, and that is the use of whatever we collect that might be commercialised and so forth. But yeah, it is a space where we've got a number of players, and it'd be good if we could start to align them a little bit in where we're going. Another question we had, great presentation. Love the concept of gift to and how we're stewards and custodians. So how do we embed such expectations in the genomics research agenda? And the question was whether you had a comment on that, Alex.
Yeah, well, I think we should, part of the story is presenting and reframing the discussion around genomics and its interrelationship with Indigenous interests. So I think part of it is us being very vocal about that. I think we do need very strong Indigenous engagement in governance mechanisms for genomics in Australia. I think that's underdone for now, but that's an ongoing conversation. I think clearly we need to remind the scientific community, or at least inform them of a different way of viewing Aboriginal health outside of the deficit lens, which is how most of our health status is constructed. And that's why I try to talk I have some slides around saying, well, you know what, we do stuff really, really well. And we do stuff better than you as mainstream academic science in a couple of areas. And it'd be really good if we had a chat about that. I know that seems a little bit sort of twee. I am fundamentally a diplomat, although I can hear half of you laughing about that now, you buggers. I am a diplomat, and I do want to take people on a journey together. I think we need to embed ourselves. The problem for us is we don't have enough Indigenous people in this space. And I noticed that a comment later, Tom, from Bastian, you're absolutely right. We need to train the next generation of Aboriginal and Torres Strait Islander people to lead this agenda. And if we do not do that, if we don't start now, we've missed the boat and we'll be left behind. And I don't mean left behind because you haven't got access to genomic testing. I mean, the whole field will miss out because it hasn't engaged with Aboriginal understandings. And that's the great loss. Because if you look at, some of the opening comments from Tiffany was your DNA is your instruction manual for how you have to live and survive. We've got Chukulpa, right? That was the law. That defined how you live and survive in this continent. So it's not that we don't understand the importance of that instruction. We need to be a part of the conversation for the future of all people, not just Indigenous Australians. Indigenous people engaging in genomics future is good for everyone. And we need people to accept that.
Yeah. And one of the things, just a little plug for the Charlie Perkins scholarships, we've funded 2 people. One is nearing completion of her PhD in genomics from Oxford University, and a second is about to go over. COVID slowed things down to do, I think it's an MPhil in genomics. And so, we're getting a couple of people from the top universities in the world looking at this space, but there's still room for a lot more. And it's not only in the high level research, which is often difficult to break into for an Indigenous researcher, but, just in the grassroots community level interaction. And I guess part of what Simon will talk about is that, and Greg actually, is about how do we get that health literacy on genomics out there and engage communities in a meaningful way. And I think you talked about the free, prior and informed consent sort of approach that we need to, if we really want to engage in this space. Now, I'm falling a bit behind in my questions. Abby sent me another one, unless you also reading them. Yeah, from Luke, again, recognising your talk and the concerns around the notion of genomics potentially having an ability to reconnect the mob in stolen generations and how that might work. And but the whole issue of false promises and not leading people, and I think you covered off on this. We don't want to give people an expectation that the whole, all of their issues will be solved through genomics, particularly in the short term, or precision medicine. This is something that takes time. And there was also the other comment on how do we embed, the more the determinist perspective into the whole discussion.
So very briefly on Luke's question, I'll take it as a comment, Luke. I think you've it is both the concern with false promise as well as some of the repercussions of findings and what it may mean, particularly for people who are desperately trying to find a part of them that was taken away from them and their families historically. So I think that's a difficult space. I think how can we reconcile the social determinants of health agenda? I think genomics offers an absolutely critical window, particularly the epigenetic space. How can we understand the impact of context on the way in which your genetic architecture and your biology operates? We've talked it for ages. It's become part of all of our policy in Aboriginal health, the social determinants of health. We've got very few intervention trials that actually lead into responding, and we don't understand how it gets under your skin very particularly well. And I think genomics offers both an answer potentially to how it does influence health status, but also by intervening and looking at change, particularly in the dynamic nature of epigenetic phenomena, we may actually be able to approach interventions and change from 2 angles, both how intervening does something to your genes and also what genes are involved in social disadvantage and poverty. So I think it offers a tremendous window. We just need to be well trained to take the next steps together.
Yeah, and I guess that there are the ones that not only have an impact on Aboriginal Torres Strait Islander people here, but impacts on people around the world. And one that comes to mind really prominently is the Mikado-Joseph disease that impacts on some Aboriginal and Torres Strait Islander people in some communities, but it's also globally got an impact. How do we, you know, and I guess it's more of a comment, but that's a priority area, I think, for us here in Australia to really look at and get more engaged in, but also get the researchers and the medicos to want to engage in something like that, because it is a small number of people in you know, population terms, but it is a dramatic impact on us.
Yeah, I agree.
Yeah. Okay, well, look, that seems to be what I have by way of questions so far. But Alex, thank you very much for your presentation. It's really been, you know, open like TIFFs. It's given us enough to really go by in understanding the scene a lot more.